Well, we've been looking into the rise of anxiety and depression among teenagers and why more teens are seeking treatment for these mental health complications. Doctors and other health professionals say there are certain factors playing a role, but also more awareness is leading people to talk about it. Here's more in the things that count.
Whenever it really starts to get to the point where it's interrupting their functioning, we really need to take it serious.
Psychologist Kelly Jones says she's seeing more teens in her office for anxiety and depression.
There's really a push for kids to get identified and to, be able to access services.
Psychiatrist Dr. Susan Slade says she is seeing the same thing and believes awareness has something to do with it.
There's been a mental health stigma issue for since the beginning of time, I suppose. I do see some element of more awareness of it and more willingness to talk about it.
A Pew Research Center study of 1,000 teens ages 13 to 17 found an overwhelming 70% say anxiety and depression is the most critical issue facing themselves or their peers. Compare that to only 55% of them citing bullying as an issue and even less concerned with drugs or alcohol. Typical pressures teens face, like school, college prep, and sports, contribute, but social anxieties could be what's really tipping the scale.
Our kids are spending a great deal of time on screens, and not only does that disrupt their sleep, but it does not encourage them to be involved in other things in their life where they're actually social when they're with other people. Kids who already have a genetic tendency toward depression and anxiety have a real difficult time coping with some of those stressors that they're facing now.
And parents need to look for certain behavioral changes in teens for signs of possible anxiety and depression. That includes loss of interest in things your teen typically enjoys, changes in sleep patterns, changes in appetite, an overly sad mood or irritable or angry mood, and also isolating or withdrawing.